Hi everyone, we're from group 5. We're going to introduce you with our group member. First we have Henry, and then Q, and then we have Tina, and after that we have me. First, Henry is going to explain more about diabetes.
Thank you, Afi. I will now introduce you briefly about diabetes.
This is one of the global health issues that is affecting millions of people around the world. According to the World Health Organization (WHO) 2024, the number of people living with diabetes rose from 200 million in 1990 to 830 million by 2022. In this video, we will hear about diabetes experiences, explore diabetes records in China and Solomon Islands, and further discuss the proposed tax regulation on beverages that Indonesia is currently taking as a measure to combat diabetes. So, what is diabetes and why is it now becoming something urgent? Diabetes is a non-communicable disease that is directly related to high sugar level in the body that leads to serious damage to many of the body's systems, especially the nerves and the blood vessels. According to the World Health Organization, the number of people living with diabetes has quadrupled since 1980, with an alarming rise in type 2 diabetes, particularly among children and adolescents.
Thank you, Henry. Let us now hear about the experience of diabetes treatment, especially for pregnant women, from one of our group member, Tina.
According to my own experience, China takes diabetes seriously, especially for the early screening. I had gestational diabetes when I was pregnant, and there was no symbols for that until I found it during the prenatal checkup. So for the screening procedure, as a preparation, we need to fasting for 8 to 12 hours prior to the test. Then a venous blood sample is collected to measure fasting blood glucose levels. After the fasting blood draw, the pregnant woman drinks 300 milliliters of a solution containing 75 grams of glucose within 5 minutes. Blood samples are taken at 1 hour and 2 hours after consuming the glucose solution to measure blood glucose levels at these time points. So the normal results will be fasting blood glucose is minus than 5.1 millimole per liter, and blood glucose at 1 hour post glucose is less than 10 millimole per liter, and blood glucose at 2 hour post glucose is less than 8.5 millimole per liter. If all three values are within these thresholds, the screening is considered normal, and the risk of gestational diabetes is low. If any of the blood glucose values meets or exceeds the numbers above, the diagnosis is gestational diabetes. If you are found having gestational diabetes, hospital monitoring is often required. A tailored nutrition plan is developed based on the pregnant woman's weight, gestational weight, and activity level. This includes calculated daily calorie needs, balancing the carbohydrate, proteins, and fats, increasing dietary fiber intake, and regular blood glucose monitoring. If the diet and exercise alone fail to control blood glucose, with fasting levels exceeding 5.8 millimole per liter or post-meal 2-hour levels exceeding 6.7 millimole per liter, medication is required. Insulin is commonly used during pregnancy, and the type, dose, and the time of insulin are adjusted based on blood glucose monitoring results. Pregnant women are advised to monitor their blood glucose levels at home using a glucometer. Measurements should include fasting blood glucose, pre-meal, 2-hour, post-meal, and bedtime glucose levels. Keeping a record of these readings helps the doctor adjust the treatment plan.
Oh, thank you, Tina. As we know that diabetes affect all countries around the world, so now let's take a look at some diabetes findings in China with our group member Q.
In November 2024, the survey report on diabetes perception of China compiled by the Health Communication Research Team of the School of Journalism and Communication of Peking University was officially released. The prevalence of diabetes in China is increasing. The report shows that the public awareness of diabetes is still in a relatively basic stage. With the change of dietary habits and lifestyle, the prevalence of diabetes in China has also increased rapidly. According to the latest data released by the International Diabetes Federation, as of 2021, the prevalence of diabetes in people aged 20 to 79 years old in China was 10.6%, and the number of patients reached 141 million, the largest number of diabetes patients in the world. Moreover, from 1990 to 2021, the age standardized incidence, prevalence, and deaths increased in China and have become the fifth leading cause of death in China, along with kidney disease. What is more worrying is that it is likely that more than half of people with diabetes do not know they have a disease, and it is necessary to raise public awareness of diabetes. According to the results of the report, although the public understands the possible risk of kidney disease and vision loss, but seriously lack proper knowledge for other types, especially those that are at high risk of death. For example, the risk of cardiovascular and cerebrovascular disease was 2 to 4 times higher than non-diabetic people of the same age and gender, but only 43% of respondents were aware of the association between diabetes and vascular disease. Therefore, the current public has not formed a full understanding of the harm of diabetes in China. In addition, another noteworthy phenomenon is that the diabetes susceptible groups in China have a lower awareness rate of diabetes than the other groups. The students and the workers group, as the most obvious group, sedentary and lack of physical activity, their cognitive rate is 32.25% and 40.43% respectively. Both of two data did not reach the +9. As a high-risk group, office workers and students do not have enough awareness that they may have diabetes.
Thank you, Q. From China, we now move to the Pacific and find out about how diabetes affects Solomon Island with our group member Henry.
Solomon Islands is a developing country in the Pacific Ocean that has no exception to the rise of diabetes. Way back since 2012, diabetes was declared a crisis in the Solomon Islands. According to the World Health Organization (WHO), Solomon Islands recorded a high number of deaths related to diabetes. This was revealed by WHO Technical NCD Advisor for Solomon Islands, Christine Franzen, during the World Diabetes Day in 2020.
Solomon Islands has a high burden of chronic disease, with 39%, 4 out of every 10 people will die from cardiovascular disease, heart attack, or stroke. 10% will die from diabetes, 7% from chronic respiratory or lung illnesses, and 4% from cancer. Likewise, the risk factors that contribute to these diseases are also of concern. 88% of all adults have an unhealthy diet. 37% smoke cigarettes, and with men, that number is 56%. 22% do not get adequate physical activity levels, and more than 3 out of 4 men are heavy drinkers of alcohol. In the Solomon Islands, approximately 1 out of every 3 adults have a high blood sugar level. 1 in 5 have prediabetes, while 1 in 6 have diabetes. And according to a 2010 study, The Global Burden of Disease, high blood sugar level is a leading metabolic risk factor in the Solomon Islands, leading to other chronic diseases. In other words, if you have diabetes, you are more likely to develop other chronic diseases, such as cardiovascular disease, which can lead to a heart attack or stroke. It is more important than ever to practice healthy lifestyles, including quit smoking and using tobacco, reducing alcohol and betel nut use, by eating more healthy, local foods, less processed foods, and making sure that you're moving your body and getting enough physical activity. These things will help to prevent or reduce the impact or the burden in individuals who already have diabetes.
Thank you so much, Henry. Now we move on to Indonesia and look at the proposed tax regulations on beverages as a measure to control diabetes. In an interview, we talk with Indonesian Consumer Foundations, or YLKI, with a tax regulation team member who explained more on this. In this interview, they explained the importance of advocating sweetened beverage taxation. So he is Rio, the head of a legal division in YLKI, and she is Rafika Zulfa, or Vika, the researcher in YLKI.
Memang kita melihat ya bahwa fenomena meningkatnya kejadian penyakit tidak menular di Indonesia itu terus terjadi peningkatan, sehingga kita merasa bahwa urgensinya itu harus segera kita dorong apa kebijakan yang paling memungkinkan untuk dilakukan. Nah, kalau kita lihat kembali gitu bahwa salah satu penyebab penyakit tidak menular itu adalah karena gaya hidup.
So now let's take a look how Indonesian lifestyle is. Just give you a brief example. These are the food that commonly sold in the morning in Indonesia. People in Indonesia call this as jajanan pasar, which means traditional snacks. As you can see, most of them are either sweet or fried. And now we move to the breakfast. People in Indonesia prefer to have a sweet breakfast. For example, like this. This is a porridge.
Masyarakat itu gemar sekali mengkonsumsi produk-produk atau makanan manis. Dan salah satunya ini adalah minuman manis dalam kemasan.
From the survey conducted by YLKI, it showed that most people consume sweetened beverage on average 1 until 6 times in a week. With so many sweet products available in the market, then why is it become something urgent to increase the tax for sweetened beverages?
Gini, kita melihat bahwa setidaknya yang paling cepat dan yang paling memungkinkan untuk dilakukan peraturan terlebih dahulu. Produk-produk minuman manis itu yang paling mudah untuk diberlakukan cukai untuk saat ini. Karena memang kandungan gulanya itu sudah jelas sekian gram.
Here's an example of sweetened beverages. A black coffee containing 20 grams of sugar. Okay, so thank you for the team. That explanations from Indonesian Consumer Foundation's team, who are currently working on proposed tax regulations on sweet and beverages, which is expected to be implemented this year, 2025. We will now join Q for the conclusion.
In conclusion, diabetes is a non-communicable disease that is becoming a global health issue and is increasingly affecting many countries around the world. In our video, we have heard about personal experiences on the treatment of diabetes, especially for pregnant women, how diabetes affects China and the Solomon Islands, and we have also covered proposed excise tax on all packaged sweetened beverages in Indonesia as a measure to combat diabetes. Diabetes is a lifestyle disease, so live a healthy lifestyle.
Okay, so that's the end of our presentations. Thank you for watching. Bye bye.